Get started. So good morning, everybody, and I'd like to welcome you to our May Swetland seminar. My name is Lindsay Osborne, and I'm the Swetland Center Training and Education Lead. I just want to thank everyone for joining us this morning for a great presentation. So I wanted to start off with a few housekeeping items. You may notice that you're muted, and if you'd like to ask a question, just feel free to utilize the chat box or the raised hand feature. I will do my best to ensure that we address all of your questions that you might have. And we are recording this seminar, and I will be posting the recording to our website by the end of the week if you'd like to watch it over again or send it to anybody who wasn't able to make it today. So if you'd like to start us off, please feel free to use the chat feature. Let us know who you are and what organization you're representing, and we'll go ahead and get started. I'd also like to briefly mention our upcoming seminar that we have for next month. So our June seminar will be on the 22nd. And it will feature 4 of our Swetland Center Advisory Council members in a discussion of environmental health equity, both locally and statewide. And it will be moderated by our center's director, Dr. Darcy Friedman. And sometime during this seminar, I will throw the registration link for our June seminar in the chat box if you're interested in getting registered for that right now as well. So today's seminar features 4 of our current and former trainees of the Swetland Center, and they're joining us this morning to discuss their training experiences, an update of what their current and future career goals are, and their opinions and overall experiences in the field of environmental health research. So I have here each of our panelists and their association with the Swetland Center. So we have Carlos Lewis Miller, who is a former Swetland Center intern and research assistant. We have Samuel Boas, who's the 2020-2021 Daniel Lewis Raven Scholar at the Swetland Center. We have Roberto Martinez, a current epidemiology and biostatistics PhD candidate at CASE, as well as a freshly ambassador technical assistance team member. And we have David Ngendahimana, a former Swetland Center postdoctoral scholar, as well as an alumni of the Epidemiology and Biostatistics PhD program here at CASE. So thank you so much for joining us this morning. We're so happy to have you here. And I'm going to let each of the panelists give an introduction of themselves, talk about kind of how they got to Swetland and their journey here. So each of them have made a bio slide to talk about that. And we'll start off with Carlos.
Hello, everyone. So hopefully you all can hear me. My name is Carlos Lewis Miller. Happy to be here. So this is a roundabout slide of how I got to the Swetland Center. If I could make it longer, I would, but we all have about 5 or so minutes. I spent a semester at the University of Cape Town in South Africa. And all of these little images kind of lead down to the triangle in the Swetland Center that talks about training and education, research, and community engagement. So when I was at the University of Cape Town, I spent about 50 hours doing community service and talking a lot with both some of the students and professionals and just people that were there about their life, their country. It was my first time leaving the U.S. to go across the seas, and I had a lot of good, genuine conversations about what it looks like to engage a community that you're unfamiliar with, or that speaks a different language, or that might have different goals than what you think they have. And I think that was really the start of, or maybe a continuation of me really diving deeply into community engagement and it becoming something that I wanted to find like in a job opportunity. So moving on from that, the little circle with 4, I guess like stars in them, is a program called NVivo, NVIVO. It's a coding software. I really enjoy it because you are basically taking in information from a interview or survey and you're coding for it. That's important to me because you're using the words of other people to form an analysis, and then whatever your conclusions are based off of what those people said. And that's critical to me because I don't want to make any assumptions. If I'm going to try and help the community, if I'm going to try and do research, I want it to be from the community, by the community, for the community. The little hexagon under that is a program called Arcgis. It's a mapping software. I'm a visual learner. So again, kind of in that bottom portion of the triangle for research, it's really important to me to be able to create something visually. This is a software, and Vivo as well as a software I used when I was at Case Western, getting my master's in medical anthropology, as well as my bachelor's. And that training was really important to me because, again, I can represent myself visually, and I can also, give a product to someone that at the very least makes sense to me. Moving on, I was going to go to the Peace Corps, and then COVID-19 happened. So this was around March. I was, pumping myself up to go to Lesotho, which is the landlocked country inside of South Africa. The pandemic occurred, which halted my plans, but ultimately brought me to the Swetland Center, and that's where I started 2 months there as an intern. So I'll stop there.
Thank you so much, Carlos, for that introduction. Our next intro slide is Samuel.
So I built in some like animation so I can, like, as I talked about it, I can kind of slowly advance. Am I able to control it, or do you have control of the PowerPoint?
I have control of the PowerPoint, but I can definitely kind of go with you along with that and just advance
Perfect.
it as you go. Just let me know whenever you want me to advance.
I'll let you know when to advance. I just wanted to thank the Swetland Center for having this today. We've the group of panelists and us, we've met a couple times or before this, and it's just a great honor to be with them, and I've learned a lot, and I think it's a really good opportunity to share our experiences for everyone else. So I just wanted to thank you and for this opportunity to speak today. It's a real honor. So the way I describe, I'm a visual learner as well, and I kind of just laid a smattering of different images that kind of have talked a little bit about my journey, and just like where I'm started. So I was born in a suburb of New York City, in a place called Westport. It's a really good place to grow up. I spent a lot of time outside, and I think that's where I developed my love for science and research, and just like I spent a lot of time in Long Island Sound in terms of like being on the water, engaged in local cleanup like efforts. So I think that was where my interest in environmentalism kind of started. Next slide, please.
Sure.
I went up I-95. This is a map of Boston. I went to undergrad at Tufts University. I majored in biology, but then also took a lot of different coursework in geology, social theory, and anthropology. And I kind of was interested in the intersection of health and sociology. And I worked in a lab for 2 years that looked at critical literacy and health literacy. So how people are able to think and critically appraise their situation. I think, next slide, please. Oh, no, one back. During my time at college, I think I was in some ways politically awakened by the time period. It was when it was 2012 to 2016. And so it was pretty politically active time in terms of the protests in Ferguson, People's Climate March. I was involved in labor organizing and contract negotiations, and just able to see, I think, in terms of my coursework and then the bigger things happening in my community and the activism happening in my community made me realize that there's a lot of inequity in this country in the way that the system and the systems have been organized and engineered work for certain people and don't exactly work for others. And so as someone who cares deeply about the environment and other people, it seemed to me that I was able to get a feeling of that the system wasn't really working, and how do we build a better system, and how do we make it work for everyone rather than just a select few. Next slide, please. So that brings me to Case Western Reserve. It's kind of been a lifelong dream of mine to be a doctor. In my 4th year of medical school now. The way that I was able to conceptualize the way that I was going into medical school, I really think it's a privilege to be able to work with people hands-on and help them with their problems. But I also saw it as a way to think deeply about how systems promote health or are detrimental to health, and being able to sit at the intersection between personal and societal relationships. Next slide. Oop, that didn't come out well. That's okay.
I apologize.
No, I think it's okay. I think it's just the way that it was formatted. So in our first year, I was really, one of the reasons I chose to come to CASE is because they have a pretty interesting curriculum that in the first couple months, you learn about the societal systems and how they are impactful for health. I think one of the most important things with me and helped kind of coalesce my knowledge bases were talking about epigenetic changes. So for those who don't know, there's kind of like this balance between nature and nurture. So people's health can be determined by their genes, but also their local environment. And I found that I was always trying to coalesce the two, like what's more important? How do people develop? And I found that that epigenetic changes, so people's lived environments can actually alter their DNA and can put little tags on the DNA. And that actually can be translated from generation to generation. So people who undergo chronic stress from racism, from food insecurity, from all the different things that we know that affect people can actually affect you in your lifetime and then continue to affect you as you progress in your children and your children's children. And so I see that social justice and doing like early healthcare interventions can not only like affect you in your generations, but can have like prolonged effects deep in their life. So that was interesting because it combined all that knowledge base. Next slide, please. And then as I progressed from my second to third year, where third year in medical school, you start to go into the hospitals and get a clinical education. I just found that a lot of in clinical medicine, you tend to be located in in a very siloed way of thinking. You look at medical problems, physiology, what is going wrong and how do you fix it? And I felt that it was a little bit limiting. And I kind of desired this broad-based learning of what brought me back to medical school and to continue to be engaged in these health systems and public health processing. So there was an opportunity to come work at the Swetland Center at the Daniel Lewis Raven Scholarship. I've since been able to go to a bunch of public health conferences, engage in disaster-related research, and it's been really a good way to integrate, and specifically like panels like this today, to integrate into different learning systems and being able to move my career in a direction, become the person that I'm wanted to be able to work directly with patients, but also with a more systems-based approach. So it's been a really good experience thus far.
Thank you so much. Roberto, next.
Hi, Lindsay. Thank you so much. And also Dr. Darcy Friedman for the opportunity of sharing a little bit about our stories. I think this is a really important conversation, and I see on our list of participants a group of people that could also be sharing their experiences here, and I'm sure many others that I don't know. And it just makes me realize that the importance of this conversation is that we may end up, many of us, depending on what we want to do with our lives, in a position where we have to offer our leadership and where we have to serve in some capacity. And just the ability of speaking about how do we train individuals, right? Like in technical skills, but also in human values. It is really an important, very, very important conversation. And that's, I think, why the Swetland Center decided that sharing our stories among many others that could have been sharing from the Swetland Center, it's just an example of the importance of training people to serve. And to answer your question about how did you get it here? First, I think the first answer is zip code matters. And where you're born matters. And I was born in Central America, in Nicaragua, but I was born to a family, parents and extended family, like uncles that were really supportive. And although they were not rich, we had many resources, and they got me through actually one of the best schools in the country for high school. And that soccer team picture there is actually at that high school that I'm referring to. But also they provided me with opportunities to go to music school, to medical school. And you can see that left picture on when I graduated from med school in 2010. So my parents and extended family furnished me with love and care, and it relates to the conversation in the US as to where you're born matters, like zip code matters. The second answer to your question is I did have a huge mentor and a great network of support. And you can see here on the right corner, the bottom corner, that's me and an older man, that's Gustavo Parajon, who happened to be a graduate, who happened to have graduated from Case Western Reserve as both an MD, as an internist too. And after getting an MPH from Harvard, he went to Nicaragua and started like a bunch of organizations. But one of the things they did through his life was to mentor people. And by mentor, I don't mean just like having a moment to talk. Really, he would actually call you, he would call me and ask me, are you in class? And what class are you taking? And like, I want to see your grades, and I want to know this, and I want to know that, and supported me through the whole process, right? To the point that you can see that MPH picture graduation in Syracuse in 2015. Before he died, he had made financial arrangements so that I could actually have my master's in public health. Initially, I was thinking about the UK, and because of my wife, I ended up in Syracuse. And lastly, I think, the other answer is like in seeking and taking opportunities. That's kind of what has led me to Case Western Reserve. And as you can see, in 2011, after I graduated from med school, there is a picture in the center. That's me with a backpack walking in a rural community in Nicaragua, literally no electricity there, and no running water in the mountains, 3 or 4 hours from the nearest healthcare clinic. And I was working with community health workers to train them to be able to do 3 things. One was like community organization. Second was like seeing patients, literally seeing patients, like diagnosing and treating. And then also like preventive work. And then finally, you can see this picture next to that picture with the backpack. In 2018, I was honored to become the AMOS board chair. So the same organization that I was working with. I was offered like to be in the board and later to be the chair. And I just mentioned this as just to make the point that my interests in life, through med school, through working with communities, have kind of led me to in this path where I had the opportunities to go into some schooling. But in addition to that huge network of support that I had, is really what had made this happen, right? Not only whether I made an effort, but whether I really had the support that I needed to be able to be in this like PhD at Case Western Reserve, but also in many of the other opportunities that I've had like across my life. I'll stop there. I see 5 minutes of my answer here. So thank you, Lindsay, for asking that.
Yes, thank you for your response. And we have David's introduction, and I think, if I'm not mistaken, yours has some animation as well. So please let me know when to advance and I can move through it.
Sure. Yeah, so I started out, I'm going to start after college. In 2010, I joined run the national insurance company as an actuarial analyst. Essentially trying to evaluate risk exposure for the insurance company in terms of people making claims. So I was working in the life sector where you develop annuities and things of that nature. Next, please. So, but after some time, I got an opportunity to come to the US to study, and I went to Youngstown State University. It's right down the road here. Where I did my master's in mathematics and statistics. And as I was doing my master's there, I also was a math tutor, like an undergrad math tutor. And after I graduated in 2013, I worked there as an adjunct instructor or lecturer for math. Next, please. Then after actually my master's, when my dad came over and he looked at my capstone, he felt it was so mathy, like there was nothing about public health, and he's into public health. So he did encourage me to pursue a PhD in something that would draw me closer to public health issues. So I applied to CASE, and I started my PhD in Biostatistics and Epidemiology in 2014, August. And I was able to finish in 2019. And my dissertation was essentially in design sensitivity in observational studies. So a key critique of observational studies, for those of you who I think most of you already know, is that it's really hard to come up with causal inference using observational studies because there are so many unmeasured biases. So drawing causal inference is usually a little bit, it's not straightforward. So my dissertation was on how you, because we have a lot of, a lot of designs, observational study design, but how do you select from this potential design in a way that allows you to account for potential unmeasured biases before you even go into data analysis? So how do you make those choices? So that was my dissertation area. And then I was also a postdoc at Swetland Center. And when I look at my training, when I try to summarize my training at the center, I would think of it as an integration of environmental health and community system science. Because I was involved in so many studies at the center, and trying to think of what is the one sentence that would encapsulate everything. This is how I thought of it. Next slide, please. Then after Swetland Center, I moved to VA in Palo Alto, California. That's where I work, but I work remotely from Cleveland. And my work there is essentially on quality improvement initiatives at the VA, like evaluation of those initiatives. And most of these initiatives usually start as like randomized clinical trial, not randomized, but cluster randomized trials. So I'm involved in evaluating some of these trials to assess the impact on the quality of health at the VA. The research framework that we use in this is usually participatory system dynamics modeling research, where we have a lot of communication or exchange with frontline healthcare providers in trying to understand how the VA system works. As you know, it's one of, I think it's the biggest integrated healthcare system in the US, very complicated. So in trying to improve this healthcare, the quality of healthcare for the VA, we use this framework to be able to understand this system and then develop computational tools, like I think when I was at Swetland, we were trying to do. And then we use these tools to empower frontline healthcare providers trying to make decisions in future on how to improve the quality of healthcare providers. Understanding the system complexities and complications and the impact of time on the decision that they might make. Yeah, that's it. Thank you.
Wonderful. Thank you so much to all of you for your introductions. It's a pleasure to hear, where you started and the journey and path that you took to get here today with us. So we have a few questions we're going to kind of do in like a Q&A style. And then for everyone else attending, if you do have questions for our panelists, whether it's just a general question or maybe directed to one in particular, we are going to save some time at the end of this session to have kind of an open Q&A. You'll be able to either drop your question in the chat box, or you can use the raise hand feature if you'd like to ask a question out loud to the panelists. So just hang on to those and we will make sure to set some time aside at the end. So to kind of start us off, we have a question we'd like to ask. So what have you learned or observed regarding diversity in either academia, in medicine, or environmental health, if you would want to touch upon all of those or just one area in particular? And then kind of going from there, like, why do you think it's important to have diversity in public health and in research? So maybe we can start off, Roberto, if you kind of want to lead off with this, and then we can have others answer as well.
Yeah, thank you, Lindsay. I'd like to actually start answering this question by a quote from John Lewis, from his, that's former senator, from his book, Across That Bridge, A Vision for Change and the Future for America. It's a book that I finished reading last week. And actually, it's a very powerful book, and I would recommend everybody here to read it. But the quote reads, "The human heart is the most important frontier to conquer in the struggle for human dignity." And the context in which he writes that quote is, his hypothesis is that if we all knew, for example, someone who had suffered police brutality, or someone who had suffered immigration, like illegal immigration, or if we knew people that had been in like circumstances and that we would not be able to imagine unless they would share their story with us, that our heart will be conquered by those stories, and that our hearts then will be more empathetic to people and to the diverse stories of people in the world. Thus, the human heart, our human heart, is really the most important frontier to conquer in the struggle for human dignity. That's his hypothesis in that sense. So I do believe that we need diversity in academia, in environmental health, in professional settings, and in our personal lives. And diversity is a reminder that our own personal world is only a piece of a larger sphere. And if we truly want to understand what is happening in society and in the world, we have to really understand the many points of view that exists in our world, like the different stories of people in our world. And I think I'm Latino, I'm from Central America. And one thought that I have when you ask that is that COVID-19 has actually reminded us of this beautiful reality that the environment has no borders. Diseases no borders, right? Like we're all interconnected, and COVID-19 halted that a little bit, right? Like I haven't been able to go back to my country for at least a year and a half. As many also people who are immigrating too as well, right? So I think that if we really want to understand what's happening in our neighborhoods and in the world, we really have to understand these diverse points of view and these diverse stories that have to do with, yes, race. It also has to do with where you're coming from, not only race, with socioeconomic status. And I'm reminded, for example, I recently met a Guatemalan woman here in New York who ventured to cross the Mexico-US border in Texas with her 2-year-old. And she was telling me the story that she jumped in the river and had to swim a little bit across the river, finally get to the other side. And then she has her 2-year-old wet, in her hands. She's changing her to dry clothing. And it just made me think, what could motivate someone to take such risk with a 2-year-old, right? So if I live in my own bubble in central New York, in my own better financial position that many immigrants that come to this country undocumented, and I don't hear the stories of these Guatemalan women, I wouldn't be able to really understand, the struggles that people go through. So diversity is really a reminder of that, and it helps us to set policy, but also set interventions that can really support people in the way that should support them, so that they can have their full potential.
Thank you. Thank you so much for your answer to that. And I really did enjoy that quote as well that you kind of opened up your response with. So I appreciate that. David, would you maybe want to comment on that and offer some input as well?
Yeah, I mean, I think what I've observed in academia, as far as diversity is concerned, is that it's still low. And I think it's not a surprise. This is not a surprise to anyone. I had one professor of color during my PhD, I think, and I had one during my master's. So yeah, I feel like it's still low, the representation of perhaps people of color in academia, especially in institutions of higher learning. Maybe things have changed since I left, maybe graduate school. But yeah, those were my observations. But I'm seeing more and more people of color interested in environmental health. because this is one way of essentially empowering them. I think this is come to a realization of empowering people by trying to understand the environments where they live, what food they consume, what toxic exposure they're exposed to, is because most of the time you'll find that people, like marginalized communities, tend to live in such neighborhoods where the environment really is a risk to their health. Somebody, I think, said the zip code is now more important than your DNA code. So so understanding the environment, I think most, at least some of my peers that I've talked to, are interested in environmental health research. And just maybe to point out something that I think is also important to have, why it's important to have diversity in public health and research, is that it increases the trust in communities that are affected by the environment. If they see themselves in the research, or the people that are conducting the research are from their communities. So it's very important for them to also see, to see people involved in this type of research being people that reflect the experiences and things of that nature.
Yeah, that's definitely a great point. I don't know if Sam or Carlos would like to add anything to that. We do have a couple minutes. I'm keeping track of time for each question, but we do have a couple minutes if either of you have any other input to offer as well. Otherwise, I can move on to the next question.
Yeah, one thing that I'd say really quickly is
Sure.
There's a concept in language and probably a bunch of other fields called practice theory. I really like it because, I'm a visual learner, but if you just imagine drawing a dot, and then from that dot, you kind of just go in a circle just forever. That's the idea of practice theory. And the reason why it's a visual representation is because this point is where you're socialized. And then that point where you're socialized basically determines how you perceive and interact with the world forever. Now, obviously, that can be changed and edited by the people that you come around. But I think, people can have these conversations about nature versus nurture, but socialization is a pretty strong force. And if you don't have people around you that have been socialized differently, or if you don't have people around you with just vastly different life experiences, you not only will have a hard time understanding where they're coming from, but you really won't be able to understand their difference. So if they're not around you and if you don't build a relationship with them, it's kind of inconceivable to understand and relate to what this other person is going through. So I think diversity, as much as we throw the word around, it's still very important, because if you don't surround yourself with people that look different and think different and act different, you will have a really hard time learning and adapting to those types of people, whether they are your coworkers or people that you're trying to do research for.
Mm-hmm. Great answer.
Yeah, I wanted to talk a little bit about what David was saying, and I think it's such a great point. I think there's often this fallacy in public health and in the sciences in general that experts are the only people who have the ability to talk about problems, those who've studied it extensively for years and years and years. I think the fact is that climate change and environmental injustice and all these things that we talk about has disproportionately affected people marginalized in society. And who is more an expert of scenarios than people who have lived experience and are able to talk about it, right? And so I just wanted to echo what David was saying, and saying that including communities that are having a lived experience allows for more embodied research, and kind of the Swetland's mission of being able to join community and research together, I think needs to be informed by communities that really understand the problem.
Absolutely. Those are all really wonderful responses. And yes, I would agree with you on that. I'm going to move on to our next question. So if you would tell us about the organizational culture, if you wanted to touch upon that, of the Swetland Center, and how that supported your training and development, and kind of going off of that, have you been able to carry this into your new or current work environment, wherever you are at this point in your life? So Carlos, do you want to start us off for that?
Yes, I have a funny story to kind of answer this question. One of the first conversations that I had with some of the people from the Swetland Center, her name was Jennifer King. She's moved on from the center since now, but one of the first conversations I had with her, I think it was like a one-on-one, or maybe there were some other interns in the meeting as well. It was a Zoom meeting, so you can't really feel out how this person actually feels about you when you're in this type of meeting. But my head frame going into this was, okay, I'm an intern, probably going to be a workhorse. This is how the next 2 months are going to play out. And one of the first words out of her mouth was, this program is for you, to build you, to help you. Like, we want you to come out of this with more skills, more knowledge, more mentors, better teamwork. Just, we're trying to grow you. And that kind of caught me off guard, not because I didn't expect her to say it. I mean, I don't really give people the benefit of the doubt anyway. But that was very tone setting for the next 2 months. Because with the first conversation, her saying, this is for you, like, we're trying to grow you. This is actually training. You're not an intern just to be a workhorse for us. You're an intern for us to build into you. Like, we are investing in you. That is not something you hear frequently, especially in the professional field. And that really left an impression on me, because with those being the first words that I heard from someone from the center, I kind of thought everyone else in the center had that disposition, and they did. And it was just really odd going to some of the staff meetings where people are having genuine conversations. I'm like, oh, I'm not used to coworkers being this genuine with each other. And it was a very good environment to be in. Not necessarily new. I think I've had a lot of luck. I've been very blessed in terms of supervisors I've worked under. But the Swetland Center is unique in that the organizational culture is very knit together. And they probably exemplify teamwork. I can't really think of another organization that supports each other as much as the Swetland Center does. And as far as the job that I'm currently working, I work for the Allegheny County Health Department. I'm one of the 20 or 25 disease investigators. So it is a department in Pittsburgh. We're basically calling people disgruntled people, mind you, that have tested positive for COVID at any age range, to try and explain how they can quarantine safely, how they can isolate safely, answer any questions that they have. And I'm happy to say that I think I've been able to supplant some of that Swetland culture into my team, so that the pods that I'm working in, we actually do have real conversations and check up on each other and try to live with and for each other. So stop that.
Thank you so much for your response. It seems like you had a really great experience, and it's really nice to hear that you've been able to kind of carry that into your role now. Would anybody, maybe Sam, would you kind of like to touch upon your opinion on this?
Muted. Sure. Thank you for the question. So I think one of the most important things about working with the Swetland Center and the experience that I've had is kind of the ability to work with people from different modalities of thinking. I think certainly, like, my focus in my career is going to be in the clinical setting and working as a frontline healthcare worker. And so usually a lot of the work that happens in the healthcare center tends to be tertiary prevention. So people who come in with problems, and then you focus on the clinical science, and then the imperative is to get them out of the hospital as quickly as possible. In my limited experience as a trainee, it's been sometimes frustrating seeing that the primary prevention and the secondary prevention of keeping people healthy and out of the hospital is not necessarily in the spoken language of the work that people are doing. And I think a lot of the times the systems that we are disgruntled with, and the inequities that we see in the community and the society are rehashed when people come into the hospital. People in the hospital are especially vulnerable. They don't have control over their scenarios. They're in a strange place. They're sick. And it's a complete new setting. And so I think being able to be a clinician who can work in multiple settings and work with different people. So in the Swetland Center, I've been able to work with people who PhDs in epidemiology, biostatistics, environmental health, GIS studies, to kind of understand how people are coming into the hospital, what's exactly going on, and then being able to think like with multidisciplinary about how do we get them out, and what ways can we prevent this from happening again, has been like particularly eye-opening for me. And I think in terms of how I'll be able to carry this into my like new and current work like environment, it's going to be challenging. I think that's something that I'm continuing to struggle with, because only like a certain amount of time in the day to do the work. But I think being able to have departments and like administratively, like from top down within a hospital that are linked with community, and their research is geared towards the community and people who that is important to them. I think that's something that will carry me through, and something that I've certainly brought from the Swetland Center. It's been important. Yeah.
Thank you. Thank you so much for that perspective too. I don't know if maybe Roberto or David would like to offer their input as well.
Yeah, I can say that one of the things that impacts me a lot from the culture at the Swetland Center is this idea of community-based participatory research, right? And it's not only the technical ability to conduct community-based participatory research, but also the desire to engage the community. And it relates, I think, to the question that we have in the chat, but Dr. Brandy, right? He's asking, I would love to hear input from the panel regarding the issue around having the majority of those doing the research in health, justice, equity tend to not be from the background of those most affected by the injustice and inequity, but through community-based participatory research, which the Swetland Center's culture promotes, we are able to engage community members to really participate not only in the data collection, but from the get-go, right? Like from defining what question are they interested in? Like, how should we answer that question? Who should we engage in answering this question? And more importantly, I think, is what are the solutions to many of the issues that the community raises? And I think back to this question of like, what are the issues of those who conduct research and versus the community? Typically there is a mismatch, right, between the researcher and the communities. The community members participate in research because they want to see their communities improve. Researchers, not all, but most, or a good part, I would think, participate in research because they want to answer a research question. And that's a complete, difference in motivation. But I think we also have to realize that, we all have privilege, either those who are conducting research and not from the community, or in my case, for example, if I was in Nicaragua and conducting research in Nicaragua, I still have the privilege of being trained and have the ability, of accessing the resources. So I think I'm in total agreement with Dr. Brandy Phipps, who says, yeah, we need training for people coming from underserved backgrounds. Absolutely, I agree. And also, however, everybody who is in academia or in a position of leadership should remember that we have the privilege of serving too, and we have the ability of engaging with communities and working with communities to include them in the process of research or in the process of designing a program or whatever. So I think I agree that the culture in the Swetland Center, it's in that direction, and I think I continue to be reminded in a current experience that I have over the next few months to engage the community in designing questions and thinking about the solutions for it too.
Thank you so much, and thank you for addressing that question in the chat. I think that was a really great question, so we thank you for asking that. David, I don't know if you wanted to offer your opinion on this or your opinion on the question that was also asked in the chat.
I just want to comment on the organizational culture at Swetland Center that supported my training and development. The one thing is the center had external collaboration with people who are in my line of work or research interest, biostatistician. So me being able to tap into Darcy Friedman's network of biostatisticians helped me learn new skills, learn better way of communicating as a biostatistician. So I felt like that access to Darcy's network was key to where I am right now. The other thing was being given a day for professional development, for me to cultivate my own collaborations, work on my own research interest beyond what the center was focusing on. That was key because it's from those collaborations that I was also able to sort of get involved in publication with people in clinical research, not necessarily public health, but clinical research. And having that experience working with both clinical researchers and public health researchers, I think that was an enriching experience for me. And that culture was very key to my training and development.
Wonderful. Thank you so much for your answer to that. So we really only have one more question prepared for our panelists that I would like to hear their answers to. So kind of wondering where you see yourself in 5 years, and that can really be, physically, however you want to interpret this. Physically, where do you see yourself being located, and kind of, what kind of work are you doing? But then maybe as like a metaphor, where do you see yourself, and like how do you see yourself becoming like this well-rounded person? You can answer this really any way that you would prefer. And I don't know, Roberto, if you want to start us off, but we'll definitely give each panelist the opportunity to answer this one as well.
Thank you, Lindsay. And I think one of the questions you asked right now is like, how do you nurture your human values in relationship to where you want to go in 5 years? And I think that's actually probably one of the most important questions. And I just want to say that, we typically are pointing at politicians or people in leadership in an organization, in a university or in a business that have committed a crime or that have done something that is like against other people, right? And we have to remember that people like them actually were in our universities, right? Like, and we're just people like us at some point in their lives. And I think that question of like, how do we make sure that we nurture our human values to be able to not be tempted to do wrong to people, it's actually really, really important. And I really believe that, and I'm very inspired by hearing the stories here, that many of the people that are participating, either talking here or like in our audience, will be in positions of leadership. And I actually invite you to think about yourself in that regards, and think about how are you going to nurture yourself so that you can provide a role model of a life lived with ethical values. And I see myself actually just in a very simple way wanting to serve. And it could be in the US or it could be in Nicaragua. And I think about it like particularly with organizations, right? And I think two practical ways in which I can do that. One is in helping organizations be more structured, be better governed. And this has to do with from developing a board of directors to like training staff to be able to develop like good programs to serve people. And you can do that either at a company with like consulting or serving in a role where you are like training them as well to do that. And I have to say that my experience in the board of directors of Amos actually has opened my eyes to these kind of issues. Additionally, however, I see myself to involve in some kind of like training for like other generations as well. And it doesn't have to be necessarily formal or informal. It could be informal too. And not necessarily in a university, it could be within an organization as well. So that's really my only goal, and balance that with my family life, which is really one of my most important enterprises. I want to end up with a solid family with children who are equipped and able to live life in the most a happy life if they can do that. So that's what I envision for me in the future.
Thanks so much, Roberto. Carlos, you would like to go next?
Yeah, so hopefully I'll still be in Cleveland, Ohio after 5 years. The weather might push me away, but we'll see. One of my passions is health literacy. So in the same way that you can give someone a book, and if they can't read it, they're illiterate. If you give someone their health records, or if you try and explain to them their plan of care and they don't understand it, then they're health illiterate. And health literacy is really important to me. I've had a lot of family members that have many chronic diseases, one of them being dementia, which is exceptionally difficult to deal with. But it's very important to me for people to be able to communicate with each other. Linguistics is, something that I love. And, when you're talking about a person's health, that's something that's important to myself and my family. So hopefully I can use some of the programs I mentioned earlier, the In Vivo program and the Arcgis program, to still be engaged with the community, such that any data that I would obtain or analyze is from the community. I think it's important to me, especially when we're trying to communicate out results, that we involve the community in the making of that data as well as the analysis of that data. So I'll stop there, but I think finding a position that allows me to use the programs that I like to use, as well as focus in on improving health literacy in communities that need it, is where I'd like to be.
Wonderful. Thank you so much for your response. Sam, if you want to go next.
Sure. So in 5 years, I will be finishing my residency program. So I have like a minimum of 5 years of training after I finish medical school. So I think one of the things that is becoming apparent to me is we don't operate in silos. We are very much integrated with the organizations that we work with. And I think we don't operate on ourselves. We are operating on the backs of the people who have been before us and operating on the works of the people before us and the institutional culture that you're part of. So I think connecting to what Roberto says and to what kind of the figurative aspects of this question, I think I would love to be a servant and to live a life that are in line with providing health and equity to all people. I think part of the challenges of that is finding an organization that has values that align with your own. And they're certainly operating in the markets of the healthcare system. It's hard to find an organization like that, and hard to find the people who employ you that you really like. The work that you want to be doing is in line with that. But I think being able to interrogate that and also bring your experiences to a job that isn't necessarily perfect, and to change the culture from within, or to find an organization that you really believe in the work, is important nonetheless. So in 5 years, I'll be looking for a job, hopefully with an organization and work that is able to bridge the gap between public health, clinical outcomes, and really advocate on behalf of communities and health justice for everyone.
Great, thank you so much. And David, if you'd like to offer your input on this question.
Yeah, so in 5 years, I hope to probably have like a major research portfolio within the VA, exploring environmental impact on military service members, especially those who are being exposed to toxic materials or chemicals. So that's my plan, to have like an R01, or in the VA they have what is called an IIR. It's like a merit award. So I'm thinking of being there, maybe starting with an R21 the next few years and moving on to the R01, but focusing on that the topic. The one question that I'm kind of also wanted to hear from other people, not just the panelists, is like work-life balance. I mean, short of winning like a jackpot, I don't know how I can get that actually going. Like, because especially with this pandemic where you're working from home, now sometimes work crawls into your life completely. But yeah, trying to find strike that balance is a little bit, it's something that I'm finding not so easy to do. And I would like to hear what others have to say here.
Yeah, I think you bring up a really good point of work kind of bleeding into, personal life in this whole pandemic situation. I can definitely relate to that as well. It's hard to draw like a solid boundary. But yeah, if anybody else would like to offer input on that question, kind of turning it around on any of the people in attendance, or if anybody else has an additional question for our panelists, we have several minutes left and we can kind of open the floor up to answer those. So I'm actually going to stop sharing my screen because that's all I have in terms of presentation. But yeah, we'll kind of leave it open if anybody would like to ask anything. And I do have a question too, but I will definitely allow anyone else to ask.
I know. I also see Tim is showing his video, so I think he's interested in a question.
Oh, Tim, do you want me to unmute you?
Sure. I was actually showing my video at the request of one of the panelists. David thought that I should show my face. I do not have an answer to his wonderful question, but I have to say I have more of a comment than a question. I think it's so cool to hear the different perspectives you guys have on making the connections to the people that are affected by the environment. Everybody here, right? And everybody that's not here is affected by environment. So we need to have everybody represented. And I think all of you talked about it in such an insightful way. But I have no answer to the work-life balance. Ooh, Dr. Brandy Phipps put something.
Yes, we do have a response in the chat from Dr. Phipps. We really appreciate your response. So she says that she has 3 kids, 2 teens and a tween, that they are homeschooling even outside of the pandemic, and it is difficult, but it is doable and requires a lot of recentering of values, goals, reminding herself that while the work is important, it's not the only important thing, which I think is such a great thing to bring up. To just reminding herself that she needs to model the maintenance of mental and physical health if she's going to be a teacher or researcher for others. Thank you so much for your response. We all appreciate it, and it's we appreciate your perspective as well. And I would imagine that homeschooling, either in the pandemic or not, would definitely pose a challenge at times. So thank you so much.
And I do agree with that too, because I have 2 children, one is 4 and the other one is about to become 2 sometime soon. And I really think about that a lot in terms of recentering my values and my time, right? So that I can provide them, particularly because they are not fault of being children, they need their time. Recenter my time and my values so that I can provide them with the time. And sometimes I do try to find balance, sometimes I can't find it. And I tell myself that that's fine, that I cannot find balance. Sometimes I don't have to sleep as much. Sometimes I sleep enough. Sometimes, we're very busy with work. Some other times we actually have to make sure that we give the time to our families too as well. So but I agree, it's doable.
Lindsay, I just wanted to offer a comment or two as we're wrapping up today. One comment, just amazing presentations by these trainees who are all bringing in very different backgrounds, different goals while they were in the center, different experiences and different places that they want to go. But some of the things that I heard, and I'm using your language that was described here today, as Carlos talked about, of embodied research. So even though the environment can feel like it's out there, it's how does it get inside of us and influence who we are and the opportunities that we have. I think an important thing, and actually we're writing a grant right now that taps into this point a lot, is around connecting to networks of power. And David talked about that. And all of you have heard that statement, it's not what you know, but who you know. And one of the things that we can, and we try very hard within our center, is to help connect people to those networks. Because once you're connected, as Roberto showed, the one person in his corner, that it literally in his corner, that, you know, provided that social capital, that support, and even financial support at times. Another area that I heard was this idea of being invested in you, and Carlos brought this up as well. And I think that is unique about our center and our approach, that, you know, when you come in, like I said, everybody is so different, and that, you know, this idea of heterogeneity, variability, rather than, you know, sameness. We have one size, it's going to fit all, and you're going to leave here and go do the same thing. And that's just not the way it works. We know environments are variable. We know that people are variable, and we know that something could happen in an instant. You need to be able to adapt and do things differently. And then lastly is that capacity building. And, you know, at the end of the day, you do need skills. You do need it. If you're a scientist in this area, you need to be able to do the methods, and you need to be able to do them with rigor. And I think that is another area that, given the opportunity to work on the various projects, students, trainees can grow in their capacity. And, you know, one thing that wasn't mentioned, but is sort of within our center overall, is this culture of learning. Just this belief, and whether it's working with our community partners, our trainees, our faculty, our staff, we all have something to teach, and we all have something to learn. And, you know, kind of keeping that freshness in our approach, and, you know, and that everybody is a teacher in that space, and everybody could be a learner as well. I do want to also comment, and somebody made a comment about this when we advertised the program, like, whoa, why do you have a all male presentation? And, you know, as the Swetland Center, we are attentive to issues of inclusivity and equity and representation. And yes, we had an all male panel, but the reality is that, you know, unfortunately, a lot of men are actually not as, you know, commonly seen within spaces focused on environmental health equity. And so and this is where it kind of comes back, you can't just assume one size, like, you know, all men means, you know, it's an oppressive panel. But in reality, you know, we think deeply about what it means to be diverse. And actually, in this area, being male is diverse. And so we have a lot of perspectives. We have amazing people that are representing various kinds of gender forms. And so we are really happy to have the panel, and also recognize that call to continually diversify and engage a lot of different perspectives. So I'm super thankful. We've had these 4 panelists. We have a bunch of other amazing people on the screen, including some folks from Central State University. It's an honor to have you here today. And I've already been in touch with Dr. Phipps on email. And so we hope that there will be ways for you to engage in some of the other efforts of the Swetland Center moving forward. So thank you. Those are my closing remarks. And Lindsay, if you have anything else before we wrap up.
I just wanted to say thank you so much to the panelists for speaking to us today. I really enjoyed hearing all of your perspectives. And I also wanted to thank everyone who's in attendance today and, you know, joining us for this discussion. I think is very important and insightful. So, yep, just a final thank you to everybody. So, yeah, happy to have you here. So thank you, everyone.